Welcome back and Happy New Year. Welcome to 2025. Can you actually believe we're here? As we start 2025, cheers to good health and cheers to you. Last week I took a break to celebrate the holiday with my family, but this Wednesday I'm back. And in this week's episode, we will discuss high blood glucose levels and their effect on the body. As we move forward in the new year and you focus on your goals and managing your blood sugars, let's work together to strive for numbers within our target ranges to make the most impact on our blood sugars. So if it's your first time visiting, please like, share, and subscribe. It's a new year with new goals, and I need your help to reach the masses. So share me with everyone you know. So high blood glucose occurs when the body has too little insulin or can't properly use the insulin it produces. And this happens for several reasons, which we'll cover in other episodes. Some common reasons include your body isn't producing enough insulin, you're experiencing stress, and it could be good stress or bad stress. You may be sick. This can impact your blood sugars. You may have eaten more food than you normally eat. You may have limited your physical activity. So why is elevated blood glucose such a problem? If you watch episode 3, you may remember the visual I used to explain what happens when we have too much sugar in our bloodstream, elevated blood sugars. So if you haven't seen episode 3, I would encourage you to go back and check out my demonstration with corn syrup and water. Now let's get back to why elevated blood sugars are such a problem to deal with. Over time, too much sugar in our bloodstream leads to complications. Why? Because our blood wasn't designed to flow with excess sugar. High blood glucose over time can cause fatty materials to build up inside our blood vessels, and this buildup reduces the supply of blood and oxygen to the parts of our body that need it most, leading to damage that affects both the small and large blood vessels. When your blood sugar levels are constantly high, it can have serious consequences for your health. And here's why. Number 1, damage to blood vessels. High blood sugar can damage the lining of your blood vessels, leading to poor circulation. And over time, this can cause complications like heart disease, stroke, and high blood pressure. 2 is nerve damage. Nerve damage, also known as neuropathy, elevated blood sugars can damage the nerves, especially in your hands and your feet. And this can lead to tingling, pain, and even loss of feeling, which increases the risk of injuries and infections, as well as falls. The third complication is kidney damage or nephropathy. Your kidneys filter waste from your blood, but high blood sugar can damage these delicate filters. And over time, this can lead to kidney disease or even kidney failure. Next, eye damage, number 4. The small blood vessels in your eyes are particularly vulnerable to high blood sugars, and this can lead to vision problems and in severe cases, even blindness. 5, increased risk of infections. High blood sugar weakens your immune system, making it harder for your body to fight off infection. This means you're more likely to get infections in your skin, gums, and other areas. Number 6, poor wound healing. Elevated blood sugar can slow down your body's healing process, making cuts and wounds take longer to heal. And this is especially concerning for people with diabetes, as it increases the risk of serious complications like pressure injuries and even amputations. But here's the good news. It really is some good news. It's not too late to take action if you're experiencing high blood sugars, now or in the past. If you've been told your blood sugars are elevated, consider the following steps. Number 1, I want you to seek out the expertise of a certified diabetes care and education specialist like myself. Number 2, I want you to look for local diabetes education and support services programs that are in your community. And if you can't find one, I want you to reach out to me. Number 3, know your numbers. Monitor your blood sugars if it's been recommended and see how your treatment is working. This can be done by a traditional blood glucose monitor or a continuous glucose monitor. Also know your blood pressure and cholesterol readings. Number 4, talk to your doctor. Talk to your doctor about making changes to your medications or your lifestyle. Number 5, work on reducing stress through exercise, medication, meditation, and good sleep. Managing elevated blood sugars is achievable, but it starts with education. It takes time to problem solve the causes, learn techniques and strategies, and set personal goals for what to do and how to do it. I want you to remember that nothing is impossible, and together we can learn how to reduce complications and live life on our terms. In the words of my first diabetes mentor and friend, diabetes doesn't have to be your best friend. You just have to learn how to get along with it. So keep that in mind and let's do this. We've got it. You've got this. And again, thank you for joining me, and don't forget to subscribe. Don't forget to share. And follow me for tips and information at Live Weldon. I look forward to seeing you again next week. And again, Happy New Year!